Good afternoon, this is Dr. B. Virgil, board-certified pediatrician and expert in helping families and communities develop physically healthy and emotionally resilient children. This afternoon, I want to talk to you all a little bit about an issue that's near and dear to my heart, childhood suicide. Many of you have seen in CDC data, Center for Disease Control data, that suicide is now the second leading cause of death among children 12 to 21 years of age. That is astounding. And what's most heartbreaking about it is that this is largely preventable. So what I want to do over the next few weeks is walk you all through a series where I can help educate you about the risk factors that some children will exhibit if they are at risk for suicide. I want to talk to you about some of the recommendations from the American Academy of Pediatrics for screening children and for getting them plugged in to help, and talk a little bit about the stigma of suicide, which is largely why this has become such an issue. As a society, in our communities, in our families, in our homes, this is something that we rarely talk about. And unfortunately, suicide lives in the shadows. So I want to bring it out of the shadows because one of the number one issues that will help our children is raising awareness. And once we have that level of awareness, we can provide the help and resources. We also need to understand that depression and anxiety in children is very different than in adults. And so we're going to talk about that in the weeks to come. A conversation about childhood suicide would not be complete if we did not talk about the effect of social media and bullying on children. And so we're going to talk about that. We're going to talk about the time that our children spend on the internet and the conversations that they're engaging and the effects of negative conversations, name calling, and such on their emotional well-being. So I thank you for taking some time to listen to this introduction. I look forward to sharing with you in the weeks to come. I look forward to your questions and your comments, which I hope you will leave in the thread below. And thank you so much for your time. Have a great day. I cannot